Hello guys, hello family, hello friends. This is Dr. T and welcome to Clinical Medicine. If you are watching for the first time, please consider subscribing. Please like and share. You are welcome to comment. Yeah. So in this video guys, I want us to just go through this ECG. So I hope you guys have been watching this series. So it's gonna be a very long series because we want to get to the bottom of an ECG. We shouldn't be having friends of ours who are afraid of even looking at an ECG. That's the whole plan. So please watch guys, watch. If you haven't watched the bundle branch block discussion that I uploaded sometime or earlier today, you're gonna get a bit lost here. So I would advise you to go and watch that one first before you come to this one, because if you watch that one first, everything will just make sense here. Okay, so this is a very nice ECG. I did this ECG about 2 weeks or a week ago, can't really remember. So it's a very nice ECG. It has got all the leads. This is lead 1, lead 2, lead 3, V1, V2, V3, V4, V5, V4, no, V4 is this side, sorry, V4, V5, V6, and our augmented leads, our 3 augmented leads. So we've got everything here. When you look at this ECG, one thing that is striking is the rhythm strip. Why is it striking? Most of the time the rhythm strip is lead 2, but in this case, for some reason, the machine decided to make the rhythm strip to be V4. So that's our rhythm strip, and I've told you guys about the rhythm strip. It's the longest tracing on the ECG. All the others are very short. This is the longest. It actually records, or it's been recorded over 6 seconds, right? So so for you to figure out the rhythm and the rate, you use the rhythm strip. So in this case, let's check for the rhythm pattern. The pattern of the rhythm in this case, you can see that this is irregular. Even before you can start trying to count the boxes and anything like that, it's irregular. Look at this distance. Oh, sorry. Look at this distance. This RR interval is very long compared to this one. And this one is also very short. These ones, they look almost the same with this one, but this one, it has got a size of its own, so it's irregular. That's the bottom line. So now if it's irregular, we know that if it's irregular, there are 2 methods we can use to calculate the heart rate. We know that if you have been watching this series, you'll know what I'm talking about now. So we know that we can't use the 300 big box method. We can't use the 1500 small box method, because you only use those 2 when the heart rate or the rhythm is regular. So in this case, we are only left with 2 options. We will use the ×6 method. You can use the times the 6 second. I've shown you guys how to do the 6 second method. You can use the 6 second method, but in this case, I'm gonna show you the remember this, what the 6 second method. Please guys, go and watch that video. But with the 6 second method, you count the number of QRS and you multiply that by 10. But in this case, because I don't know what is really, I'm not sure if I took the entire picture of this ECG. I'm not sure if I'm missing any QRS there at the end, somewhere here. I'm not so sure. But let's assume that I've got everything. So if you want to use the ×6 method, what you will simply do is you will calculate, or not calculate, you will count the number of R, or the QRS, okay, just say QRS, or the R waves. So this is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So let's say we've got the entire rhythm strip there. So we've got 11. So 11 multiplied by 6 will give us 66. So the rhythm in this, the heart rate in this ECG, the heart rate is 66, and we know that it's irregular. So we know two things now, right? Okay. Now that we have that out of the way, what is the cardiac axis? That's the next thing that we need to answer. What is the cardiac axis? So if you have been watching the ECG series, you will know that you use lead 2 and AVF to figure out the cardiac axis. So what you do, you look at lead 2 and AVF. You look at the QRS complex, whether they are positively deflected or negatively deflected. They are negatively deflected here, and also in AVF they are negatively deflected. So if both of them have got negative deflections, not deviated, sorry, deflections. So they are negatively deflected both of them. So according to our quadrant method, since both of them are negatively deflected, it means we are dealing with this quadrant. So this is an extreme axis deviation, right? So we do have our cardiac axis here. It's an extreme axis deviation. So what do we know so far? We know that the heart rate is irregular. We know that it's 66. We know that the cardiac axis is an extreme axis deviation. Now, we are going to go to the pathology. I think all of you can see where the pathology is in this ECG. But let's check if the rhythm is actually a sinus rhythm. Okay. There are a couple of ways. Not a couple of ways. There are other things that we need to look at to decide if the rhythm is sinus or not. But the easiest way that we have been taught ever since is to check whether all the P waves are followed by a QRS complex. But in this case, we can see that this is our P wave. There's a QRS complex there, P wave, P wave. Even on lead 1, this is our P wave, P wave, followed by a QRS complex, right? Even here on AVR, even though they are negatively deflected, the P wave is there, but they are there. Okay, in case you didn't see, let's try and zoom. So these are our P waves. You can see P waves there, P wave there. So that's not the P wave. The P wave is here. There's a P wave, the P wave there, there's a P wave there. So every P wave, so after every P wave there's a QRS complex. So we can say this is sinus rhythm. All right. Now let's get to the pathology. Without even being told, you can see that this ECG has got broad QRS complexes, especially in V1. Broad QRS complexes, they're very broad. And when you've got broad QRS complexes, you already know that you are thinking about a BBB, a bundle branch block. But before we can get excited, let's count the number of boxes. So if we can count the number of boxes, if we start counting from here, and we count from here, how many small boxes are there? It's 1, 2, 3, 4. So we've got 4 small boxes, and we know that we're supposed to have 3 small boxes for us to have a normal QRS complex. In this case, we've got 4. So we are confirming that actually we do have a broad QRS complex in this ECG. Let's look for another QRS. Let's check. Let's look at this one. Okay. So here is our line. Remember, the way you count, you must look and be sure that you are not starting in the wrong place. Look for the isoelectric line where it starts to deviate, whether down or up, doesn't matter, but where it starts to leave where the wave starts to leave the isoelectric line. So if we can count the number of boxes here, let's try to count. It's 1, this is 1, this is 2, this is 3, this is 4. So we've got 4 small boxes again. So this does confirm our broad QRS complex. Beautiful. Beautiful. Okay. Now we are certain that we've got a bundle branch block. At this point, we can discuss this patient with the cardiologist for a cardiac echo and all of those things, especially if the patient is stable, they don't have any hemodynamical instability, that kind of a thing. So we can discuss for a clinic date, because it's not an emergency, for them to actually get a proper assessment by a cardiologist. Ne? But so what I'm trying to say is that as junior doctors, you don't really have to know if it's a right or a left bundle branch block. You don't really have to know, but knowing whether it's a BBB or not, it's important to know. BBB, right? But we are going to take it further in this video and classify this BBB and decide if it's a left or a right. Let's do that. Okay. Again, if you have been following this series, you will know that when you talk about when you've confirmed a BBB, the next thing, so if you want to classify your BBB, whether it's into left or right, you need to look at 2 leads. The 2 special leads that you look at is V1 and V6. Right? There is a name that I gave you guys during the on that video that I uploaded during the day, a way of trying to remember a way of trying to remember a right bundle branch block or a left bundle branch block. So we said that if you want to remember, like in this case, we've got a right bundle branch block, but I'm going to prove it to why I'm saying it's a right bundle branch block. Okay, so the name that I told you about is Moro. M for Moro, M is V1, W at the end of Moro is V6. So for you to suspect or to diagnose a right bundle branch block, you must have an M-shaped morphology in V1 and a W-shaped morphology of the QRS complex in V6, right? Let's check what is happening here. So this is V1, so we are looking for an M-shaped morphology. In V1, throughout is just M, 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 M. If you can pay close attention, you will see that this is an M, this is an M, this is an M. Even though there's a notch there at the top, but we are gonna actually ignore that in this video. So where is the M that we are talking about? Here is the M that we are talking about. Very clear. So this is how it goes. This is how it actually goes. So that's a beautiful M right there. So this is an M-shaped morphology, and it's in V1, just like Moro says. V1 should have an M shape, V6 should have a W shaped for you to suspect or to diagnose a right bundle branch block. What I want you guys to actually notice here is that from the isoelectric line, the first deflection when it's an M, it's up. That's how it is. It's up like that. That's the first deflection. It's upwards, right? This is different from a W shaped morphology, which we're gonna see now in V6. Let's go to V6. Okay. So here is V6. Sorry. Let's get to V6. Here is V6. Let's get to V6. This is V6. And if you can really let's zoom in. We've got our beautiful W here, guys. You can see that's a W. It's like this. As an electric line, there's a downward deflection, a small downward deflection, and then it goes up again. Then it does that. Then it comes back to the isoelectric line. You can see. So let's look at it again. So you've got your, after your P wave, you've got a small downward deflection and a smallish upward deflection and a very big downward deflection. Then it goes back again. Doesn't go back all the way, but it joins the rest of the line. So this is a W shaped morphology. Even if you want to count the boxes here, let's count the boxes here. Let's count the boxes here. So if you want to count, you'll start from here and end here and here. So let's count 1, 2, 3, 4 again. There are 4. So remember the name. This is what helps us to remember Moro. This is V1. This is V6. This is a right bundle branch block. The two R's they stand for right. And then in V1, M-shaped morphology, V6, W-shaped morphology. If you have been watching, you'll know that if it was a left bundle branch block, we have William there. We have got William, meaning V1 is W, V6, the QRS there is M-shaped. Then that would be a left bundle branch block. I hope you guys will enjoyed that. Thank you so much. Please guys, support my channel so that I can be motivated to keep posting and keep sharing information. Thank you. Bye.